Dr. Li Zheng, a graduate of Beijing University of Chinese Medicine and a PhD in neuroscience in the United States. With over 30 years of experience, she blends Chinese acupuncture and Western medicine to treat patients holistically. She spent over 5 years at Dana-Farber Cancer Institute, helping cancer patients manage insomnia, neuropathy, and treatment side effects. Since 2016, she has served as Director of Natural Medicine at the American Chinese Medicine Exchange Society and as adjunct faculty at Massachusetts College of Pharmacy and Health Sciences. She is the author of 5 books and has been featured on Chronicle as an infertility specialist since 2000. Dr. Greg Albert, a board-certified family medicine physician and founder of Boca Direct MD in Boca Raton, Florida. With advanced training in integrative medicine from the Andrew Weil Center for Integrative Medicine, he combines traditional care with evidence-based natural approaches. A Boca Raton native, he returned home to redefine healthcare through the direct primary care model, focused on proactive, personalized treatment and long-term wellness. His mission is simple: to help patients achieve optimal health and lasting longevity.
Today, the topic is neuropathy. Dr. Albert will explain what kind of neuropathy we commonly have and what's the mechanism we can get you better with Eastern method and a Western method. Dr. Albert graduated from
I graduated from medical school at the University of South Florida just before the pandemic started, actually, in 2019, and I'm licensed and board certified in family medicine. I also have a certificate in integrative medicine, so I like to use a lot of herbs and supplements in my practice here called Boca Direct MD.
Yes, and Li Zheng is the acupuncturist who has practiced acupuncture and Chinese herbs for over 30 years. So we both accumulating a lot of experiences to treat neuropathy, and neuropathy become a common issue not only for older generation but also for 30, 40 years old people. So what is the common category of neuropathy?
So there are many different causes of neuropathy. I think the first one that's very common is diabetes. Uncontrolled blood sugar levels can cause damage to the nerves, which can trigger inflammation and cause neuropathy, that pain that people experience who have diabetes. There's several different supplements or herbs that we can use to help with this.
Yeah, and that's the common type, but recently Dr. Albert noticed that the heavy metals like zinc.
Yes, so a lot of people have been taking zinc since the pandemic, and they've been taking zinc in excess of the 40 milligram upper tolerable limit, and that can cause nerve damage and balance issues, which we'll discuss a little bit.
Yeah, that's why I find people who take too much supplements, they end up different kind of neurological issues. They have neuropathy, unknown neuropathy, or they even have Parkinson's disease. If you ask them, they all eat healthy and they are vegan. They take so many supplements, including turmeric, which stimulate nerves, and peppers. So nerves, your nervous system like to be relaxed. So if you relax, the nerves are repairing. If you keep stimulating nerves with different things, coffee, black pepper, and turmeric, then your nerves are firing up constantly. And everybody knows the MSG. Is that MSG?
Monosodium glutamate.
Yes. And the reason it causes numbness around your lips is because it stimulates nerves that much, and that will cause the inflammation of the nerves. And when the inflammation of nerves lasts longer, then the nerves will lose the function. Initially, the symptoms will be like abnormal nerve activity, tingling, numbness, and then once the nerves get more advanced changes, and then the pain, and then eventually the nerve dies, so you don't have the sensation and has other issues, right?
Yeah, interestingly, MSG is, I think, the #1 trigger for migraines.
Yeah, that's probably stimulate the nerves too much, so that when the nerves are firing up, then your blood vessel responded, either constriction or dilation, that cause different kind of headache. So what's the other reason could cause neuropathy?
So, I mean, there's another cause, which is autoimmune, which bundles together a lot of different diagnoses. So you're looking at like Lou Gehrig's disease and other types of rarer forms of neuropathy, or maybe MS, like multiple sclerosis, that we don't really understand fully very well. I think there are certain things that we can do to help, mitigate the damage being done to the nerves and potentially improve quality of life for people in those categories.
Yeah, I think autoimmune is also related with nervous system. So when people constantly stimulate their nerves, and they also stimulate their immune system. So when the immune system is out of balance, hyperactive, then they produce antibody attacking our nerves, our joint. So we have rheumatoid arthritis, we have neuropathy, MS, ALS. So being bored and relaxed is not something that people like, but it's beneficial for the nerves, beneficial for our health. The other common cause of neuropathy is musculoskeletal neuropathy. So if you have sciatica, carpal tunnel syndrome, and nerve get irritated, inflamed, and that can also cause neuropathy, right?
Right, and some people with weight changes, they can get compression of a nerve from their belt that they wear or their waistband, and this can cause something called neuralgia paresthetica.
Yeah, so different kind of neuropathy, we have the mechanism of inflammation and circulation. So if the nerves are inflamed, first the nerves will firing up abnormally, and then it gradually lose the function. So to address this two mechanisms, we have to improve the circulation, and also we can also reduce the inflammation. And a common medication is what? Gabapentin, right?
So a lot of people are taking gabapentin to help reduce the pain that they feel associated with neuropathy. But this doesn't necessarily address the underlying cause, because if they stop the gabapentin, then their pain comes right back. So, I think it's important to also address the underlying cause and work on that inflammation that's causing the nerve to be irritated. So in diabetics, a lot of times that's uncontrolled blood sugar, so getting that blood sugar under better control is so important. There's also a supplement that diabetics can take called alpha lipoic acid, which is an antioxidant and can really help the body better cope with that nerve damage and prevent it and kind of repair the nerves a little better.
Yes, the other way, so gabapentin can stop your nerve firing up, so the tingling, pain may be diminished at the beginning, but if you don't get rid of the root cause, inflammation and the circulation issues, the nerves eventually will lose its function. So acupuncture can be used to instantaneously improve the circulation of your nerves. But you cannot do acupuncture 2-3 times a week forever. You really need something that you can take daily. So the herbs comes to help you reduce the inflammation and improve the circulation. So what herbs you suggest?
So it depends on the type of neuropathy. There's actually a new study that just came out last year, interestingly, where they used topical chamomile for carpal tunnel syndrome, and it seemed to significantly help people versus the group that did not take the topical chamomile. So that's something worth exploring, more in the future. Of course, with carpal tunnel syndrome, you also have to worry about compression of this median nerve here at the wrist.
Yes.
So that's something you can target in other ways with wearing a brace at nighttime, things like that. But I think acupuncture can be very helpful to increase blood flow and help the body repair some of the damage being done And then some of these herbs or supplements can be used to help reduce that damage that's being done actively through antioxidants or anti-inflammatory mechanisms.
The other thing with herbs is once the circulation improved, the peripheral nerve can regenerate. So the first step is to use herbs, improve the circulation, and get rid of the inflammation, so the existing functional herbs will function better because they get better blood flow, they don't have inflammation anymore. The second step is you need to regenerate the damaged nerves. So that takes a long time. You destroy those nerves within at least a couple of months. You have to give yourself a couple of months to regenerate the nerves. And once you have the regeneration, then your nerve reserve, when you get to older age, 90, 100, will be much better than you continuously damage the nerves, and then your reserve is diminishing. Eventually, you get to the point that the nerves just don't function well. And when you sit there, your feet look purple, and then you couldn't feel the surface, and the swelling of the ankle, and you couldn't move, and you're lightheaded all the time. Your balance is changed, and that's the time that it's hard to reverse.
And I think it can even take a year or more for nerves to repair and recover. So there's some evidence of that, for certain conditions or for people who take certain medicines for a long period of time and then they want to get off of these medications. It can take their body a year or more to even recover from that and get back to their baseline where they were before they started those medications.
Yeah, so be patient, but you will get benefits even with 1 or 2 acupuncture treatment, because your existing functional nerves will improve the function instantaneously. But you cannot stop there because you have to address the circulation inflammation. So because the nerve degeneration is an ongoing thing, you get older, I'm getting older, so my nerves gradually degenerate faster. You want the regeneration faster and slow down the degeneration so you can keep your nerve function well until you reach 100 years old.
Right, and we want to figure out what's the cause of the nerve damage. So if someone's taking too much zinc, like over 40 milligrams a day, then they can be causing nerve damage. And sometimes that actually affects copper absorption and causes a relative copper deficiency. So that can affect people's balance. It can cause neuropathy, nerve pain in the extremities, like hands and feet. So that's something that people need to be aware of. And if someone wears dentures, interestingly, the denture paste, actually a lot of them have zinc in it. And so that zinc gets absorbed through the gums and into the bloodstream, and that can cause neuropathy by itself. So that's something where people need to be very conscious of everything that they're putting in their body.
That's the right suggestion. So keep our nerve healthy and they can serve us better. If you destroy the nerve function, then it takes a long time to resume. So we need to be patient, and if you want to get the best result, then East meet West is the best way.
Right, and there's some evidence that different mushrooms like lion's mane mushroom may accelerate nerve growth factor, right, to help with nerve regeneration.
Yes.
There are other supplements too. I had one interesting case, with a person who had toe pain just in the big toe for decades, and we didn't know exactly why. Had a full workup of everything, but interestingly, medical marijuana seemed to really help tremendously with her pain. And so if that's the only thing that works, and it's safe in those cases, then it can have some antioxidant effects and help, even though we may not know the underlying cause or the trigger of that, at least we can help reduce some of the pain.
Yes. So if we couldn't figure out what's the reason, then always address inflammation and circulation. Then your body can function better and your body can produce more nerve growth factor to help the nerves regenerate faster than degeneration.
Right, and hyperbaric oxygen therapy may help too. It's a little expensive and it can be claustrophobic for some people, but I think that can help accelerate the nerve repair and blood vessel growth.
So if you don't have the time or money to do that fancy treatment, I will just go to the beach and walk there, combining deep abdominal breathing. Your oxygen level will go up right way and your nerve come down to repair, regenerate.
Right, and everybody should do that anyways, right?
Yes, beach is free. Oh no, it's not free in Boca. It's expensive in Boca.
Yeah.
Any questions, you can email us at li.acumagic@gmail.com or
bocadirectmd@gmail.com. Yeah, but there's a lot of, this is a very broad topic, so there are a lot of different potential causes of neuropathy. So it's really important to go through every detail, figure out everything people are taking in, all their environmental exposures, and to try to understand what's causing it, so we can come up with a plan to fix it.
Yeah, just email us the question and you get your East meet West answer.
Thanks for joining the East Meets West podcast with Dr. Li Zheng and Dr. Greg Albert.